is Tiffany. I'm going to be the nurse who's going to be performing your heart assessment. Is that okay?
Yes.
Okay. I'm first going to start off by inspecting your chest, looking for any surgical scars indicating a pacemaker implantation, and there are none noted. Next, I'm going to go ahead and palpate your precordium. I'm going to start off at the apex of your heart, the PMI. No heaves or lifts noted. Next, I'm going to place my hand on your sternal border. No abnormalities noted. And then at the base of your heart, no thrills noted. Next, I'm going to compare your PMI, the apex of your heart, with your carotid artery. If you can take a look to the left for me, please. And they are both synchronous, which is expected. Next, I'm going to go ahead and percuss your chest. I'm going to start off laterally. And I hear pulmonary resonance. And working my way medially, I hear cardiac dullness. Laterally, resonance. And medially, cardiac dullness. Resonance. And dullness. Next, I'm going to auscultate your heart sounds with the diaphragm of my stethoscope. I'm going to start off by assessing your aortic valve, which is in the second intercostal space. S1, S2 noted. Regular rate and rhythm. No murmurs noted. Next, I'm going to go to the pulmonic valve. Regular rate and rhythm. S1 and S2 noted. No murmurs. Next, the tricuspid. Regular rate and rhythm. S1 and S2 noted. And lastly, the mitral valve, or the PMI. Regular rate and rhythm. S1 and S2 noted. Okay, and that completes the heart assessment. I'll be doing your major vessel assessment. Is that okay?
Yes.
Okay, I'm going to first start off by assessing your jugular venous distension. If you could take a look to the left for me, please. Okay, and as you can see, you see the jugular vein, but there's no jugular venous distension noted. Next, I'm going to palpate your carotid artery. 2 plus expected amplitude, regular rate and rhythm, contours round and smooth. And to the right for me. 2 plus expected amplitude, regular rate and rhythm, contour is round and smooth. Next, I'm going to auscultate your carotid artery, and I'm going to place the bell of my stethoscope, and I'm going to be listening for any swooshing that may indicate a bruit. No bruit noted. No bruit noted. Next, I'm going to assess your peripheral pulses. I'm going to start off with your brachial pulse. 2 plus expected amplitude, regular rate and rhythm. Your radial. 2 plus expected amplitude, regular rate and rhythm. Your popliteal. 2 plus expected amplitude, regular rate and rhythm. Your posterior tibial. 2 plus expected amplitude, regular rate and rhythm. And your dorsalis pedis. 2 plus expected amplitude, regular rate and rhythm. I'm going to assess bilaterally. Your brachial. 2 plus expected amplitude, regular rate and rhythm. Your radial. 2 plus expected amplitude, regular rate and rhythm. Your popliteal. 2 plus expected pulse, regular rate and rhythm. Posterior tibial. 2 plus expected amplitude, regular rate and rhythm. And your dorsalis pedis. 2 plus expected amplitude, regular rate and rhythm. Next, I'm going to assess for any edema. Bilaterally, I'm just checking to see any indentation in the skin. No No edema noted. And lastly, I'm going to perform an Allen test. If you could place your arm out like so. Okay, I'm going to go ahead and occlude the radial and the ulnar artery. And if you can pump your fist 5 times for me. Okay, as you see the blanched palm, and I slowly release the ulnar artery, and there's perfusion back to the palm, so there's no ulnar insufficiency noted. And that concludes our major vessel assessment.